All right, so today we're diving into something, well, a little different.
Different good, I hope.
Oh, definitely different good, but maybe a little intimidating too, just at first glance. We're talking about Legg-Perthes disease.
Ah, yeah, I see what you mean. The name itself can be a bit of a mouthful.
Right, you hear that, and you might think it's some rare, super complex thing, and while it's not exactly common, it's also not as rare as you might think. And the complex part, well, we're here to break that down.
Exactly, because knowledge is power, right?
Wow.
Even with medical conditions.
Absolutely. So, Legg-Perthes. You've sent us some medical information on this, and we're going to try to unpack it for folks who maybe haven't encountered this before.
It's one of those things that, until it touches your life or someone you probably haven't heard of it, which is true for a lot of medical conditions, really.
That's so true. So to start off, what exactly is Legg-Perthes disease? In the simplest terms possible.
In the simplest terms, it's a childhood condition that affects the hip joint. Specifically, it disrupts the blood supply to the femoral head, which is that ball-shaped part at the top of your thigh bone. Imagine a ball and socket joint. The femoral head is that ball.
Okay, so we're talking about the hip joint, and something's going wrong with the blood flow to a crucial part of that joint. And this primarily affects kids, right?
You got it.
Yeah.
Primarily kids, and what's fascinating and a little frustrating for doctors and families is that we don't definitively know what causes this disruption in blood flow.
Yeah, it's like a medical mystery. Our sources say it's more common in boys, usually showing up between the ages of 4 and 8. And get this, they use the term idiopathic, which basically means doctors are still trying to pinpoint the exact cause. It's a reminder that even with all our medical advancements, there's still so much to learn.
Exactly. And to add another layer to this puzzle, Legg-Perthes directly affects the blood supply to a specific part of the hip bone called the femoral head. Imagine the hip joint like a ball and socket. The femoral head is that ball.
Okay, that makes it easier to visualize. So we're talking about the hip joint, and if the blood supply to that ball part gets messed up, that spells trouble, right?
Exactly. And the way this trouble unfolds is through three main phases: necrosis, revascularization, and healing. Now, necrosis might sound a bit scary, and to be honest, it is a bit concerning. It's the stage where the bone is not getting enough blood and starts to break down. Imagine a small plant that's been underwatered. That's kind of like necrosis.
Ouch, bone breakdown. Poor plant, poor kids. That sounds rough. So what happens next? Does the bone just stay broken down?
Thankfully, no. That's where revascularization kicks in. Think of it like this. You see your sad, wilted plant, and you give it some much-needed water. In Legg-Perthes, blood flow returns to the bone, and the body tries to repair the damage.
Oh, okay, so the body's trying to fix things. That's good. But you said it was concerning. What makes this revascularization phase tricky?
You're right, the body wants to heal. But remember that plant analysis. When a plant is recovering, it's still fragile. Similarly, in Legg-Perthes, the new bone that forms during this revascularization phase is quite soft and prone to deformities, especially with all the running and playing active kids do.
So it's like a race against time. The body's trying to rebuild, but it's vulnerable during that process. I'm starting to understand why early diagnosis is so crucial.
You've hit the nail on the head. Early diagnosis is key. And to help with that, doctors use something called the category classification. Think of it like a ranking system, from groups I through Phi E, that helps determine how much of the femoral head, that ball in the hip joint, is affected. Knowing this helps guide treatment decisions.
That makes a lot of sense. It's like assessing the damage to that wilted plant and figuring out the best course of action to bring it back to life. Speaking of treatment, let's talk about what parents and doctors should be on the lookout for. What are the red flags?
Well, our sources highlight several key symptoms. Hip pain, of course, but also, and this is where it gets interesting, pain in the knee.
Hold on, knee pain. But we're talking about a hip. Why would the knee hurt if the problem's in the hip?
It's a great question, and it highlights how interconnected our bodies are. It's called referred pain, where the pain signals from the hip can actually travel along nerves and make the knee hurt too. It's a good reminder that sometimes pain is like that friend who loves to play tricks on you. You think you know what's going on, but there might be more to the story.
Wow, that's so wild. Our bodies are strange and fascinating. Okay, so knee pain, hip pain, anything else? What should parents be looking out for?
Definitely. The source also mentions muscle wasting in the thigh, a limp, and often it's a painless limp, which is surprising, and difficulty moving the hip, especially moving it outwards or rotating it inwards.
Okay, so any of those signs, especially that sneaky knee pain, warrant a trip to the doctor, right?
Absolutely. Early diagnosis is key to giving these kids the best chance at a healthy, active future.
So let's say a child is diagnosed with Legg-Perthes. What happens next? What are the treatment options?
The good news is there are several approaches, and the specific one chosen really depends on each child's situation. It's like a medical choose-your-own-adventure, customized for the best possible outcome.
I like that. A medical choose-your-own-adventure. So what are some of the options on this adventure?
Well, one option is observation, which is exactly what it sounds like, closely monitoring the condition to see how it develops. This might involve regular checkups, x-rays, and keeping an eye on how well the child can move their hip.
Okay, so observation is like taking a wait-and-see approach, but with a watchful eye, of course. When would that be the go-to choice?
Yeah, it's a good way to put it. Observation is often the preferred route for younger children, especially those under 6, and when the severity of the condition isn't too advanced.
Makes sense, kind of like, let's keep a close eye on this and see what happens. But what if observation alone isn't enough? What other tools are in the toolbox, so to speak?
Right, so that's where we might start talking about orthotic management.
Orthotic management. Okay, break that down for me.
Basically, it's about providing support to the hip joint while it heals. You can think of it like a cast for a broken arm, but for the hip.
Okay, so a little extra support to guide that healing process.
Exactly. These special braces, they help to keep the bone from getting damaged further while it's still in that soft, vulnerable phase, and they help guide the healing process in the right direction.
So not completely immobilizing the joint, but making sure that whatever movement happens is like safe, controlled movement.
You got it. It's all about finding that balance, right? Enough movement to maintain the joint's health, but not so much that we're putting that healing bone at risk.
Yeah, finding that sweet spot. So we've got observation, we've got these special braces. What about surgery? Is that ever part of the picture?
Yeah, surgery is definitely an option, but it's typically reserved for more complex cases, or maybe when those other approaches, observation or orthotic management, haven't been as effective. It's like,
The heavy artillery.
yeah, you could say that.
Okay, so it's there if needed, but not always the first line of defense.
Exactly. And one of the big things that treatment, regardless of the approach, focuses on is something called containment.
Containment? That sounds kind of intense. What does that even mean in this context?
So, you know how we were talking about the femoral head, that ball part of the joint? Containment is all about keeping that femoral head snugly inside the hip socket while it heals.
Ah, I see, to make sure the bone grows back correctly.
That's it. It helps to ensure that the bone heals into that nice round shape it's supposed to be and minimizes the risk of future complications.
So it's like creating the ideal environment for that bone to do its thing.
Yeah, you could say it's like tucking that bone in and making sure it has a cozy place to recover. And there are different types of braces that are specifically designed for containment. Like there's the Scottish Rite orthosis, which allows for some movement, but it keeps the hip in a specific position to promote that ideal healing.
It's really incredible when you think about it, how these braces are designed. They're like tiny little engineers working on that hip.
It really is remarkable, and it speaks volumes about how innovative the field of orthotics has become. We've been talking about all these treatment options, observation, bracing, even surgery. But how do doctors actually decide which path is best for a child? Is it as straightforward as age and severity, or are there other things at play?
Yeah, I'd imagine it's not always a clear-cut decision.
You're absolutely right. Age and how severe the condition is at diagnosis are definitely big factors. Like we were saying, a younger child with a milder case might do well with just observation, whereas an older child or a child with a more severe case, they might need bracing or, in some cases, surgery. But there are always other things to consider.
Right, because every case is different, every child is different. So what else comes into play?
Well, for starters, families have different lifestyles, different preferences. Some families, they're more comfortable with that wait-and-see approach, while others, they might prefer to be a bit more proactive and go with bracing. And it's crucial that those preferences are taken into account. It's really about finding what works best for the child and their family.
Absolutely, it's a team effort. And speaking of teams, I want to go back to something we touched on earlier, the long-term outlook for these kids. We talked about how vital early diagnosis and treatment are, but what else influences how well a child recovers in the long run?
It's a great question. Early intervention is huge, but it's not the whole story. The severity of the condition when it's diagnosed, like how much of that femoral head was affected, how well the hip is kept contained during healing, those things play a big role. But there are other factors too.
Like what else can impact how well a child recovers?
Well, age at diagnosis is a big one.
Yeah.
Generally, the younger the child is when they're diagnosed, the better their chances of a smoother recovery. Their bones are still growing, still remodeling like crazy.
So it's almost like they're better equipped to handle the renovations going on in their hip.
Exactly. The younger they are, the more adaptable their bodies are. Now, we've talked a lot about early detection, treatment, and how well kids recover. But even when everything goes as well as it can, there's always a chance of, a few bumps in the road later on.
Bumps in the road meaning dot complications like arthritis.
You got it. Even with perfectly healed bone, the way the hip joint moves, its mechanics, might be a little different. And over time, that can lead to some wear and tear, which increases the risk of arthritis down the line.
So it's not just a matter of getting through the initial healing process. There's a long game to think about, too. So are we talking like preventative measures, things people can do to protect their hips even after they've recovered from Legg-Perthes?
Exactly. It's all about being proactive. And one of the biggest things you can do is maintain a healthy weight.
Okay, so weight management is key, but why is that so important specifically for hip health?
Well, think of it this way. Every extra pound you carry puts more stress on your joints, especially those weight-bearing joints like your hips and knees.
Oh, I see, like carrying around extra baggage all the time.
Exactly. Now, besides weight, exercise is another big one.
But with a history of hip issues, what kind of exercise are we talking about?
That's a great question, and it's all about finding that balance between staying active and not overdoing it. Low-impact activities are key here, things like swimming, cycling, even just going for a brisk walk. Those can all be great for hip health.
So things that keep you moving without putting too much stress on the joints.
Exactly.
Yeah.
And in some cases, working with a physical therapist can be super helpful. They can put together a personalized exercise program, tailored to your specific needs and abilities.
That makes a lot of sense. So we've got weight management, we've got low impact exercise, and maybe some physical therapy guidance. What about medications? Do those play a role in managing the long-term effects of Legg-Perthes?
Yeah, they can, especially if arthritis does develop. Over-the-counter pain relievers like ibuprofen or naproxen can help manage pain and inflammation. And in some cases, a doctor might recommend a cortisone injection directly into the hip joint for more targeted relief.
So those are more for managing the symptoms. But are there ways to slow down the progression of arthritis itself? I've heard about glucosamine and chondroitin supplements. Do those actually make a difference?
That's something a lot of people ask about. And honestly, the research on those supplements is a little iffy. Some studies show they might help, others don't. It's really one of those things you have to discuss with your doctor and see if it's right for you.
It's like with a lot of health stuff, what works for one person might not work for another, and it's all about finding what works best for you in consultation with your doctor.
Exactly. That open communication with your healthcare provider is so important. Don't be afraid to ask questions. Talk about your concerns. Be your own advocate.
Absolutely, it's a partnership. Well, we've covered a lot of ground in this deep dive, from understanding what Legg-Perthes is to exploring those different treatment paths and even looking at the long-term outlook and what that journey might look like. As we wrap up, is there anything else about Legg-Perthes that you want our listeners to remember?
It all circles back to what we were saying before. Knowledge is power. The more you understand about this condition, how it affects the body, the treatment options, the potential long-term implications, the more equipped you are to make informed decisions about your health or the health of your child. And that's really what it's all about.
Couldn't agree more. Early diagnosis and treatment can make a huge difference, but even for those navigating the long-term effects, remember, you're not alone. There are resources, support systems, healthcare providers who are there to help you live your fullest life possible.
Absolutely. And sometimes just knowing that you're not alone in this can make a world of difference.
So true. And on that note, we'll leave you with this. We've seen how important early intervention and proactive management are for Legg-Perthes. But how can we apply that same mindset, that same proactive approach to other areas of our health and well-being? Food for thought as we all strive to live healthier, more fulfilling lives. Thanks for joining us on this deep dive.